Hi, I'm Michael P. Coleman, Content Director for Brother Be Well. Thanking you for checking out this Parents and Caregiver series brought to you by Blue Shield of California's Blue Sky Initiative. Hi, I'm Michael P. Coleman, Content Director for Brother Be Well. Most of us are familiar with, or at least aware of, the moment at which we need to call 911 for a physical emergency. You get in a car accident, you fall off a ladder and break a bone. Someone's unconscious, maybe, and doesn't appear to be breathing. After situations like those, you or a loved one might wind up in a conventional emergency room. But just as there are moments like those, there are mental health emergencies that necessitate a similar swift intervention and a trip to the psychiatric ER. Today, in one of a series of Brother Be Well conversations in our Parents and Caregiver series, made possible by the support of Blue Shield of California's Blue Sky Initiative, we're exploring when and how to use your local emergency room when managing a mental health crisis. My partner for this conversation, Sheree Criner, registered nurse, former psychiatric nurse, and vice president of the Capital City Black Nurses Association. Sheree, welcome back to Brother Be Well.
Thank you so much for having me, Michael. Important topic here.
Really important topic. Let's jump right on in here, Sheree. First, can you share with us what constitutes a mental health crisis or emergency?
So, a mental health crisis or emergency is when the person is having mental symptoms that pose a harm to themselves or others. So, this is someone that may be causing physical harm to their body. They're unable to control their actions, which pose a risk for something happening to them, or they are actually not in control of their behaviors, and they may be causing harm to others that are around them.
I've heard of, it sounds a lot like a term I've heard before, psychotic break, and it may fit that description. I'm wondering, if you don't mind, what's a psychotic break? Is that a colloquial term for psychiatric emergency? And does a panic attack fall into that category?
So yes, that's definitely a term for a psychiatric emergency, and kind of the term psychotic break specifically speaks to kind of the change, right? Someone could have a mental illness, but very much so being controlled, being medicated. They could be having difficulty, but they may be able to reach out to their psychiatrist or their primary care provider to get help with an increase in symptoms or symptoms that are not going away. But the term break is exactly what you would think about in a psychiatric emergency. I'm at a point where I can no longer control or manage my symptoms alone. I need a higher level of help, and there's an element of risk there. If I do not receive this help, something may happen to me or others around me. A panic attack, I would drop in a different bucket. There's definitely times where you're having a panic attack and you're not able to manage your symptoms and you need to seek medical care. But if, once again, if you are able to manage your symptoms with medications or techniques that your primary care provider or psychiatrist has worked with you on, then you can have a panic attack and overcome it. The point at which you want to seek emergency services is when you are no longer able to take care of those symptoms on your own, or you're posing a risk to yourself or others.
That's really an important distinction. I appreciate it, Chris. I appreciate it, Sheree, and I know other people are going to appreciate that as well. Thank you for that. There's been a sharp influx in mental health patients heading to emergency rooms. I'm wondering what your take is on that.
Well, Michael, being a nurse in psychiatry and mental health facilities, I realize that the resources are just low. More and more places have closed down over the years, and there just isn't access to adequate care. So you have a lot of folks with no place to go, but still really dealing with their symptoms. And so they have to go where they can go, or unfortunately, sometimes the psychiatric emergency turns into an interaction with law enforcement And that's where they're met with getting help, which may result in them going to get psychiatric help, or may unfortunately resort in them going with the law enforcement route because they're unsure of how to deal with the emergency. So I think that's why we're seeing the current state that we're in, because there are just less and less places for people with mental illness to go.
Wow, wow, appreciate you sharing that as well. I hadn't thought about this. There are fewer resources available. You've got years of experience, Sheree, working in psychiatric ERs. I'm wondering if you don't mind, take our viewers and listeners behind those front lines, if you would. What does a psychiatric ER look like? I'm just so curious. What can someone expect if they or a loved one wind up there? What role do psychiatric nurses play there? And how does a psychiatric ER differ from the standard one that we might be more familiar with?
Right. So all of our standard emergency rooms, emergency departments, all are able to take a person and create that initial assessment and send people where they need to go or treat symptoms, right? So any emergency room, when someone is having a medical emergency, which is a mental health emergency, that is one place that you can go. It's often the most frequented place when someone is having an issue. Depending on where you live, they also have crisis centers for people with known mental illnesses where they can go get evaluated. And then often, Michael, you may have heard the term 5150, where someone is evaluated, and if they need to be held for evaluation, further evaluation or treatment, or even longer term treatment, then that 72 hours, then medical professionals are able to evaluate that. That team may look like a physician in the ER, a psychiatrist, a nurse, mental health workers that help attend to the physical needs while a person with a mental illness is being evaluated. And that whole team works together to make sure to keep the person safe, and also to get the treatment that is needed to get over that acute situation that's happening. So there's two goals when you seek care. One is to handle the acute situation. Are you suicidal? Have you hurt yourself? Have you hurt someone else? To decrease those symptoms. And then the second is, what now? Do we need to release you to home? Do we need to release you to a higher level of care for longer treatment? So the goal is to help that initial situation, but then also help with that next move.
And it sounds like, Cherie, that you talked about, you used the term acute situation. I'm wondering, I learned the term as I was preparing to talk to you, de-escalation. So based on what you just said, it sounds like when you talked about a situation where you're a threat to yourself or others, the goal of the entry, so to speak, into a psychiatric ER is to de-escalate that person and get them back down to that level that you're talking about. Do I understand this correctly?
Absolutely. Just as the word says, to de escalate, to bring down. So if someone is yelling, screaming, hitting, fighting, you want to use different modalities, which may be talking to the person, maybe medications at that point, to decrease that response. If someone comes in and they're suicidal and that changes, or they're no longer having the same experience that they were having when they came in, then you're able to move on to that second phase of treatment. But until you're out of that initial phase and you de-escalate the situation, then you're not really able to move past helping that initial acute phase. So absolutely.
And we've got, you and I have a separate video, Cherie, on psychiatric meds. I would think meds can play a role in that de-escalation process.
Absolutely. Medication is surely a tool where we can help to essentially chemically help someone calm down or relax. Doesn't come without risk, right? So you're taking a medication, you're at risk for side effects, at risk for over sedation. So it's definitely done with a team approach where a physician is prescribing the right type of medication to help in de-escalating when other methods are not helpful. In extreme situations, Michael, I have had to restrain patients and able to give them medication or to prevent them from causing harm to themselves. We have very strict protocols and practices to make sure that it's safely done, but all in the name of really being able to provide the safest environment for the person that's experiencing that extreme mental illness acute situation.
And I appreciate you saying that. I think some of the signs of, scenes rather with regard to restraints. We've seen them in popular movies, and just like
Mhm.
everything, they're kind of over. I bet they're exaggerated, frankly, for those mass media productions. And I think that, but those some of those images are probably what scares people a little bit when you're talking about a psychiatric ER. So the critical word, the salient word for me from what you just said, Sheree, was in extreme situations. And you said, I have on occasion. It's not something that happens every day or all the time.
Absolutely, it's not. And even if we choose to restrain a patient, then there's protocols in place where we're checking to make sure that their circulation is okay, that their breathing is fine. It's checked very frequently. And in fact, we even have a plan at which point we take them out of restraints so that you're not just tying someone, wrist and ankles bound to a bed and leaving them there. We actually have a very specific protocol in place, and that's not just led by specific institutions, but also the law and the governing bodies that oversee healthcare institutions. So it's very prescribed what to do, how to do it. And the goal from the very beginning is to get them out of restraints as soon as possible.
Got it. Really appreciate that perspective and that information.